Hello, my name is Mike Sobocinski, and I'm the instructor for Multidisciplinary Seminar in Children's Mental Health. This one-credit offering is jointly sponsored between the Education, Social Work, and Psychology programs at UAA and is a part of the Graduate Certificate in Children's Mental Health Services. I've been fortunate to be a part of this course since its inception over 5 years ago, and it's been very satisfying for me to be able to be a part of the educational journey of students who have come to UAA to specialize in working with children and their families in a wide range of behavioral and mental health settings. I really look forward to spending this time over the semester with you and in learning with you as we explore different aspects of systems work with children and families. I know that everyone will have the opportunity to review the syllabus, and there will be a discussion board this week where we can answer questions and get further clarification. However, what I would like to be able to do now is to walk through some of the major highlights of the course and to give you a little better idea of how we're going to spend our time together this semester. First thing that I want to do is to let you know that the primary emphasis of this class is on the system of care model and principles as applied to working with a wide range of presenting issues that children and their families bring to mental health, behavioral health, educational, and other settings. It's very important that we understand children within the context of their lives, which means that we have to understand them as they live in their families, as they interact with their peers, as they go to school, as they live in their communities, if we're going to be effective in our work. The other main emphasis in the class is to help you develop a greater appreciation for the role of complex trauma in the genesis and perpetuation of many of the challenges that our youth face. The goals for the course are severalfold. And again, I will let you look at these in the syllabus, but I do want to be able to emphasize a couple of things. I think it's really important that that you are helped to integrate the body of knowledge that exists in children's mental health and to see how this evolving knowledge base can be applied to a wide range of settings. It's important as well to develop an appreciation for other disciplines besides your own and to understand how to work effectively with other disciplines in the contexts in which children receive services. Another aspect of the course is to be able to relate the challenges faced by individual children and families to the larger social issues, and to see how these larger contextual issues interact with specific children who come to see us. The ability to be able to collaborate with other professionals from other disciplines and to be able to come up with effective plans to be able to work with a wide range of problems is another thing that will be emphasized in the course. We will also be looking for ways that we can help improve the services that we offer to children and their families. This can be at the level of individual programs, in organizational settings, or at the level of larger systems of care. And one of the things I want to challenge you to do this semester is to look at ways in which the material that you are studying can be applied to improving the children's mental health system in the state of Alaska. As you undoubtedly know, we've been involved in a major reorganization of mental health services over the last couple of years. Part of this is part of the governor's Medicaid expansion program, and there are many pieces yet to be figured out as we try to redesign the system to best care for children and their families. In addition, I want to spend a minute and talk to you about the format and design for the course. I've redone the format this semester to try to make the course more flexible and better suited to the small number of students that we have enrolled this semester. Typically what has happened is the course has alternated between synchronous collaborate sessions where we all come together in a given night at a certain time and interact through Blackboard, with online discussion board sessions on the alternating weeks. What I'm going to do for the first time this semester is to have the class entirely delivered in an asynchronous manner so that you can basically attend to the assignments during the week in a manner that works for your schedule. I'm hoping that this flexibility really makes the course more accessible and allows you to be able to maximize your participation in the class. Assignments are going to essentially, as you can tell from the syllabus, will be of two different varieties. The first will be a weekly discussion board voice thread assignment where you will be asked to respond to questions that help you to integrate major points in the material that we've studied, to be able to apply the material to your own particular settings, to be able to offer informed critiques of the system of care and make suggestions for how we might be able to improve the system. The second major class of assignments will be participation in the National Child Traumatic Stress Network offering of online webinars and trainings. There are several of these that you will be asked to take during the course of the semester. Again, you can take these kind of at your own pace. What you need to be able to do is to get onto the NCTSN website and register for an account. Registration with the NCTSN is free, and once you are registered, you are going to be able to take advantage of the educational offerings through the National Child Traumatic Stress Network. There is on the homepage for the NCTSN a section for the Learning Center. The webinars and trainings that we're going to participate in this semester are located on the Learning Center, and again you will have to register in order to take these offerings. The registration is free. When you go in and complete the webinars, you will get a certificate of completion, and you will need to be able to submit a copy of the certificate of completion to me as evidence that you have completed the required trainings. In terms of evaluating student work, I would again draw your attention to the syllabus where you can kind of look at the manner in which your work will be evaluated. What I want to be able to emphasize here with you is that I'm really looking to see that you have critically engaged with the material, that you're not just passing eyes over it, but you're really you're having a conversation with the material, and you're critically evaluating the strengths as well as the areas of weakness in the literature, that you are looking for ways to apply what you are studying to your own work, that you're asking yourself questions about what next steps might be in further developing our understanding in a particular area, and that you're looking for gaps in the existing literature. In other words, areas where maybe we don't know enough or as much as we need to in order to effectively serve children and their families. So, you know, as I'm reading your postings on discussion board or voice thread, I'm really looking for you to demonstrate not only knowledge of the material, but your ability to apply it and to critically evaluate it, both in terms of its strengths as well as its weaknesses. Again, this is just a very brief overview of the material that we are going to cover in each of the week's offerings. We're going to take a look at children's mental health within the context of a public health perspective. And one of the things that is so powerful about a public health perspective is that it offers us a really good avenue into prevention efforts and early intervention efforts, and so we are going to be examining public health perspectives on children's mental health. We're going to be looking at children's mental health in traditional settings. We're going to be looking at services within the child welfare or OCS system. We're going to be looking at mental health services as provided in school settings, juvenile justice, and foster care. Obviously, we could have chosen a variety of other settings, and one area in particular that could easily be included and will be included in the next semester offering would be the integration of mental health services with primary care, which, as you know, is really kind of at the forefront of behavioral health right now, and that is figuring out how our clients can obtain both primary care and behavioral health services kind of in the same setting so that it's easier to access and we do a better job of providing holistic care to the people that we serve. So, at this point in time, there may be questions that people have either of a general nature about the class or specific questions. And what I'm going to do is open up a specific discussion board thread for this first week, and it's going to be entitled Questions. Kind of tricky titling. And what I would encourage you to do is to post your question and to pay attention to the questions that your peers have as well as responses to that so that we can kind of get some clarification to things that I've not thought about or are not clear in the syllabus. In closing, I just want you to know that I really look forward to working with you this semester. I found in this class that the wide diversity of experience that you all bring to the class really makes for a richer, I think, learning experience for everybody, myself included. And like I said, I'm very much looking forward to working with you. And welcome to Multidisciplinary Seminar in Children's Mental Health.